First, I want to thank everybody for coming out here. Thank you because I've adopted the suicide prevention hashtag, no one fights alone. So thank you for proving my words correctly. I want to thank our lawmakers that are here because I made a promise on April 12th, 4 years ago, to my son Danny in front of his casket to make our lawmakers look me in the eye and see the consequences of their decisions. So I want to thank those who can sleep well at night after they've looked me in the eye. Thank you. Why am I here in Minnesota? Well, I'm wearing this red beret. It was knitted by, I believe this one was Fran Bauer from Florida. I've founded the first chapter of the National Red Berets for Medicare for All. Laura Fielding started the Red Berets, and she chose red for the national nurses in solidarity with them after knitting a bunch of pussy hats, okay? And hers, she put in Medicare for All to represent the national nurses and all that. So her idea and her concept was, we've got to use every tool available for us to fight for Medicare for All. And if her craft is knitting a red beret, maybe we can get a whole bunch of people wearing red berets in solidarity across the country. Now, what that did was she went on Proud Socialist Ryan Knight's podcast and was seen by a documentary specialist by the name of Kenny Ballantyne, who thought this was an amazing story and we should follow up on this. And he was going to do a little 20-minute video on how we can use state-based legislation to get to single-payer universal health care on a national effort. Now, she brought me in to help because I've gone to Washington State and gathered signatures for whole Washington. I think it was a little over 1,000. I've also worked very hard for the New York Health Act, and I'm proud to be here and have my healthcare Saudi apple here in Minnesota. Okay. What our thought here is, we can use state-based legislation on a national level. We have to combine our efforts across the country. You can amplify the New York Health Act as well as I can collect signatures for whole Washington, as well as amplify each other through capitalism, artwork, and whatever tools we have available. Maybe you're going to be able to reach your state legislators. Maybe you can host an action, or at the very least, show up at an action and hold a sign next to us, right? As Rose was saying, the reason I got involved, 4 years ago on April 9th, I read my son's suicide note on Facebook. Prior to that, he was living with us. Danny comes home to me one day and he goes, "Pops, I went to get my medication today and found out my insurance had been canceled." I was like, "Okay, Danny, not a big deal. How much is it?" He tells me his medication is $250. I didn't have it. So I told him, I was like, "Okay, Danny, not a big deal. You have an appointment with your therapist in a couple of weeks, and I'm sure she can help you out. In the meantime, you need to get a hold of Fidelis Care and find out what's going on." Fidelis Care was the name of his insurance contractor that he bought through the New York Exchange, which was sold to Centene Care, or to Centene, for $3.8 billion in 2018. It was founded by a father, Patrick Farrar, an ordained priest of the Brooklyn Catholic Diocese. After selling Fidelis Care to Centene, he then landed the position of VP of Centene that gets paid $5.9 million a year to deny Medicaid patients the health care that they need to live. So Danny calls up Fidelis Care. He called like April 1st or April 2nd, probably the biggest mistake that costed him his life. When he called, he found out he had missed his $20 premium for his managed Medicaid program. On April 9th, I see his post on Facebook, and he says to us, "I can't get above the pain, and I'm sorry for those who care. This is selfish, I'm sure. but I decided death by drowning. I've superglued my seatbelt shut, double-checked. I'm not strong enough to open it. Daniel and Hazel, I'm so effing sorry. And he drove his truck to the Mohawk River that day. I saw his post 32 seconds after he posted it. I screamed to my wife what was going on, and I jumped in my car, racing down to the lake because that's where I thought he was. After about 20 minutes, I realized that nobody could have survived that, and I had to turn around to tell my wife that I failed to save our son and that he was dead because he missed a $20 payment. Now, I made that promise in front of Danny's funeral to make our lawmakers look in the eye. I've been so gracious to have been cast in Healing Us, the documentary. I've been going all over this country to make people understand that health insurance is not health care. Our politicians say health care is a human right. And then the very next day, our president, after saying health care is a human right, says, I'm so proud that I've lowered the cost of your health premiums without harming hospitals, doctors, or health insurance companies. Kamala Harris shared my son's story. I was so proud. See, that's work that I did. I wrote every senator that co-sponsored Bernie's bill and said, please share Danny's story for Medicare for All. And then 3 weeks later, you might have all seen her on the stage where she introduced her Medicare for All plan to sell us, for corporations like Centene that killed my son, to sell us Medicare. She used Danny's story as a commercial for the ones who murdered him. If you watch Healing Us, I'm not anti-Democrat. I'm not anti-Republican even. I am policy-based. I say, if you don't support single-payer universal health care, vote them out. Dr. Jarvis will give you the same story. I will not support anyone that supports my son's murderers, because you can't tell me health care is a human right. Here's this contract that will deny that right for their profits. And by the way, they're paying me to keep my campaign going. That ain't right. So I implore all of you to do everything you can to make sure that everybody understands the difference between health insurance and health care. Insurance companies are not here to give us health care. They're here to make money off of us. I can't state that enough. In the movie, Amy Villela is with us, and she will tell you that she has been in the meetings, and she'll say to you that insurance companies can be sued if they're not acting in the best interest of their shareholders, not in the best interest of the patients, but in the best interest of their shareholders. So please, anybody that's interested in seeing the movie, I implore you to watch it. You can go to healingus.network.com. I'm sorry about my slideshow. I have been all over the country. This one is where we're gathering signatures in Washington State. Here in front of Fidelis Care in Latham, New York. And that would be Albany, New York, where we had a die-in. That would be Carl Heastie, who is the head of the Assembly in New York State. The New York Health Act has had the votes to pass for the past couple of years, and they stopped calling it for a vote. We have to keep pressure on our lawmakers. We have the votes to pass it so they don't call it for a vote. Everything you could do, write your congressmen, write your assemblymen, write your senators, your newspapers, everything. Make them look you in the eye. Tell them health care is a human right. I was at the introduction of the bill. Top left corner, you see that sign up there that says My Life for $20? That was Tanny. This is in front of Buffalo's Fidelis Care's main headquarters on the anniversary of Danny's death. The fourth year anniversary. No, fourth year we went to New York City, sorry. This is the third anniversary. Here we are in front of Nancy Pelosi's mansion in San Francisco. Again, the apple is there. We left a coffin on Nancy Pelosi's doorstep that said 68,000 to remind her of what denying health care will do. I again say, if you're not supporting Medicare for all, then you're fighting for the insurance company and you're supporting my son's murderers and the murders of 68,000 lives a year. That's legalized manslaughter for profit. This is a clip from me in the movie Healing Us. That was a vigil that we had in Vancouver, Washington for the 68,000 lives we lose every single year. And I point out, they're not just numbers. Every single one of them had a parent. Every single one of them was loved by somebody. Their mothers, their fathers, their sisters and brothers. There's 68,000 of our sisters and sons and daughters, not just numbers. And lastly, my granddaughter Emma, when I explained to her what Kamala Harris did with Danny's story, I was explaining to her also how important it was that a woman of color was in the position of power that she was. This was Emma's response about identity politics. That's just stupid, Papa, she tells me. Why can't people just vote for what's right? And lastly, when somebody says that I might be a purity pony with shark teeth, you're damn right I am. They killed my kid. When they say that I should talk to our politicians a little nicer, like that, that's my answer. That's how I talk nicely. Medicare for all is the middle ground. We're not asking for the insurance industry to be brought up on 68,000 murder charges every single year. That is middle ground. They get to walk free after taking their money from killing our children and our loved ones. They get to walk free. That's middle ground. We have to stop insurance companies from killing us and our children for profits. It's sick and it's wrong. And thank you all for being here.